Hello, welcome to this session about how we work with health and care professionals. I'm Jane Rideout and I've been living with Parkinson's for 17 years. I've been involved with the Parkinson's UK Excellence Network for 9 years. The session today has been pre-recorded as unfortunately I cannot guarantee my medication will be working well enough for me to present live on the day. But there will be a Q&A session at the end which will be live and we'll try and answer any questions that you have. My co-host is Gail Linstead, a Parkinson's UK Service Improvement Advisor from the North East of England.
Hi everyone.
You can type in a question at any time during the session. You just use the Q&A button that's on your screen. Any questions that are typed in during the session will be included in the Q&A session at the end. We can't answer any specific issues or concerns about individual cases or services. So any questions relating to those sort of issues should be directed to our helpline. If you lose your connection during the session, you can rejoin by clicking the link that you originally joined on. Any questions that we can't answer in this session and any outstanding questions will be answered in a document that you will receive after the session. So in this session, we hope to introduce you to how we work with the health and care professionals. We'll give you an overview of the Parkinson's UK Excellence Network in terms of structure and its reach. And we'll then cover how you might get involved and talk about an opportunity that's available right now if you're interested. There will be time for a few questions at the end of the session. And just as a reminder, if you want to ask any questions, please type them into the Q&A. The Excellence Network provides a platform for clinicians to get together, sharing ideas and good practice so that they can offer the Parkinson's community the best possible care. The Excellence Network was established 10 years ago. By chance, I was involved in the network when it was just starting up, having been encouraged by a consultant to join a project about exercise. At first, I didn't fully understand the value of the Excellence Network, but I've watched it grow and develop over the 10 years. It now brings together many more people from all over the country with the aim of improving our services for people with Parkinson's and their families. This short film will give you a quick guide to what the Excellence Network offers and what it has achieved over the time.
10 years ago, we set out to change the landscape of Parkinson's care. Health and care professionals across the UK came together with a shared goal to transform services for people with Parkinson's. That's how the Parkinson's UK Excellence Network was born. A community of specialists, researchers, and people with Parkinson's working together to drive change, share expertise, and improve Parkinson's care across the UK. Since 2015, the Excellence Network has made a lasting impact. We've funded over 56 specialist roles, building a stronger Parkinson's workforce. More than 200,000 health and care professionals have used our learning resources to improve their practice. We've received over 2,000 service submissions to the UK Parkinson's audit, identifying gaps and driving improvements.
As professionals, we're committed to providing the best care possible, but we need the right resources to do it. The Excellence Network connects us, shares vital knowledge, and ensures we're always improving.
That's why we've kept pushing forward. New grants, fellowships, and bursaries supporting professionals at every stage of their careers. Stronger regional clinical groups, ensuring that local expertise shapes local solutions. More collaborative working, bringing professionals together to share knowledge, skills, and insights.
For people newly diagnosed, the early days of the Parkinson's journey can be a very bumpy ride. The Excellence Network empowers professionals to help people navigate this journey more smoothly. I'm delighted that I've been able to contribute ideas from the patient's perspective.
10 years of driving change. 10 years of pushing for better. 10 years of impact. And we're not stopping now. Together, we'll keep going. Together, we'll keep improving Parkinson's care, because everyone with Parkinson's deserves excellent care.
So how does the Excellence Network fit in with the overall Parkinson's UK strategy? You can see that pushing for excellent health and care is a key area. The Complete Care for Parkinson's project looks at how to give everybody the best care that's possible. We work directly with health and care professionals to improve services for everyone with Parkinson's across the UK. So how do we do this? Well as providing opportunities for Parkinson's specialist healthcare professionals to share best practice and to collaborate, we educate non-specialist professionals. For example, we provide easy-to-access education about how best to care for people with Parkinson's to staff in the hospital wards. And we help people with Parkinson's and their loved ones navigate the health system, providing information needed to demand better care. Many people have a voice in the Parkinson's Excellence Network. Firstly, there are clinicians. There are consultant neurologists, specialists in movement disorder, geriatricians and Parkinson's nurses, all of whom are specialists working with people with Parkinson's. And the other healthcare professionals who work with people with Parkinson's are also represented. Speech and language therapists, physiotherapists, dietitians, pharmacists and psychologists. And I'm pleased to tell you that people with Parkinson's and their family members are getting more involved all the time.
I hope that you found that the video has given you a good overview of the Parkinson's UK Excellence Network and what it can offer. Here you can see all of our fantastic national clinical leads. The clinical leadership team are not just ambassadors of the network, they're here in a position to provide us with both the strategic guidance as well as clinical expertise. The Excellence Network regional model was relaunched in September 2024. It's made up of 7 regions that mirror the NHS structure in England. So far, we've recruited to 4 of those 7 regional lead posts with the people that you can see here, and recruitment's now ongoing for the remaining 3. The regional clinical leads model is also mirrored across our devolved nations. The network has a range of UK-wide hubs. These hubs focus on specialist interest areas, including exercise, mental health, pharmacy, the deep brain stimulation network, and speech and language therapy. The network supports the hub leads by enabling them to deliver activities, hold events, and raise the profile of their specialist area. Jane's now going to tell you a little bit more about the exercise hub.
The clinicians and therapist specialist hubs offer their members opportunities to work together on more detailed projects. And I have personal experience of the exercise hub. Nearly all of the members are physiotherapists who specialise in Parkinson's, but there are a few other members like me who have a great interest in increasing physical activity with people with Parkinson's, and they have joined the hub for that reason. The Exercise Hub runs monthly webinars to update all physiotherapists around the country on the latest techniques and ideas. They run a study day every year where all members can get together and exchange ideas and learn new approaches. They also have a very active forum-style system for discussions between meetings. Before the hub was started, many of the physiotherapists worked alone without anyone to share ideas with or to get feedback from. The hub has certainly changed that. We're now going to talk about what the Excellence Network means for you. We offer support to professionals and services so they can improve their understanding of Parkinson's and improve the care they deliver on a shared best practice. We do this by offering opportunities to connect with peers through networking. So we run events, we support regional groups, and we support these special interest hubs. We offer learning and resources, bite-sized or in depth, through the Learning Hub. And we encourage sharing of resource opportunities. We offer grants and support from the Service Improvement Team, and there are a number of different funding opportunities. And we have an influencing role, both locally and nationally. I'll give you 2 examples where I've been involved. The first was in a campaign to save a Parkinson's service under threat. And this involved meeting the trust management and ensuring that the patient voice was audible. The second example was where I was asked to be involved in a project where we were bidding for funding. And being involved right at the start of the project meant I was able to put the patient point of view about the initial scope of the project.
UK Parkinson's Audit is a fantastic tool, and it provides us with both data and insights into local Parkinson's services. The audit's actually being carried out again this year. Trusts and health boards have now registered, and data collection will take place between May and September. The audit shows us what services are delivering and where the gaps are. Service improvement can help us to understand why those gaps are there. For example, it might be due to lack of capacity. Therefore, that data can be used to support a business case for additional resources. Service improvement can also help where there's a threat to service. For example, this may be feedback from the Parkinson's community that people with Parkinson's are not getting their medication on time at a specific hospital. As we know, Parkinson's medication is time critical. We can therefore support the hospital trust or health board via the time critical medication programme to investigate and implement service improvements to rectify these issues. One of our flagship Complete Care for Parkinson's programmes is the Pump Prime scheme. The scheme allows us to support the growth of the Parkinson's specialist nurse and allied health professional workforce. Parkinson's UK can work with hospital trusts and health boards to support them to develop a business case. If successful, Parkinson's UK will then fund the post for the first 2 years. This is a fantastic way to get us NHS commitment into developing specialist services. The Pump Prime of nurses has been taking place in Parkinson's UK for longer than the 10 years of the Excellence Network. At the end of 2024, Parkinson's UK had supported 338 nurses into posts. In 2022, we also started to support allied health professional posts. So that includes physiotherapists, occupational therapists, speech and language therapy, and pharmacy. And to date, we've supported 19 of these posts, and there's more for both in the pipeline. Some of the impact of these posts includes, but is certainly not limited to, improving access to time-critical medications, reduced length of stay, and reduced hospital admissions. So
how can you get involved? I've been fortunate that when I was involved at such an early stage in the Parkinson's Network, it gave me an opportunity to get involved with the local clinicians working on a number of projects. To give you an idea of the sort of projects I was involved with, the first was a study looking at the benefit of regular exercise classes for people with Parkinson's. We were looking at how people's symptoms might change over time if they were committed to doing regular exercise. Now, I realise this is all very obvious now, but it was 10 years ago and we weren't so sure at that time. The second project was looking at how to increase patient involvement in service improvement projects, and this was aimed at increasing the awareness of people with Parkinson's that they could be involved in projects, but also to encourage the clinicians to involve people with Parkinson's to participate at all stages of their projects. The third project was looking at a new way to deliver care to people with Parkinson's who are willing and able to self-manage their condition. And a key outcome of this project was that people with Parkinson's who were able to access care when they need it, rather than waiting for a routine appointment, which is often when they don't need it. And then I was fortunate to be given the opportunity to become a regional lead for a period of about 2 years. In the early stages of the Excellence Network, the regions were much smaller and there were more of them. It was a hugely challenging role for me, but I learned so much about how the NHS works. And fortunately, I had a small group of clinical staff who worked with me in the leadership team. I'm now on the review panel for the Excellence Network grants for service improvement projects, so I get to see all the projects looking for funding from around the country. And for 8 years now, I've been a member of the leadership team. When I started this role, I had very little knowledge of how the NHS works other than as a customer. I found the early meetings quite unnerving, but I've always been made to feel welcome by the clinicians and they listen to the patient point of view. Getting involved. What can you do? Well, you can champion the Excellence Network to your health and care teams. You could invite an area development manager to talk at your branch or group meeting. And you could look out for opportunities to take part in panels such as grants or judging. You can follow us on X or Twitter, whatever you call it now, And you could subscribe to the monthly newsletter. You can contact us to find out what other opportunities there may be, for example, about getting involved in local service improvement projects. An opportunity to get involved is live at the moment. Would you like to become an Excellence Network grant reviewer? It gives you a chance to consider how grant money is spent, and will people with Parkinson's get value from the project? It's a really good way to find out more about what's going on around the country in terms of new ideas, and have your say where money is put to improve services for everyone with Parkinson's. You can email the grants team for more information or scan the QR code on the screen to see more details on our volunteering website. We hope that that's shown you some of the things that the Excellence Network does. Thank you for joining our taster session today. Remember, you can find out more on the Excellence Network web pages and think about how you could become more involved with the Excellence Network. You will receive a post-event email that includes the session recording, useful links and resources mentioned during the taster session and the evaluation form. Now over to the Q&A session.
How is the rollout of the Producer pump progressing? So at the moment, we're actually monitoring the rollout of the Producer across the UK. We're working with a lot of hospitals where they've asked for support to be able to look at what they need to be able to put that service in place. So what we're actually asking for is we're keen to hear from people with Parkinson's who are having difficulties accessing this new service. So if there is anybody out there who has had any issues, then please don't hesitate to contact us about that. What I'm going to do is I'm going to hand over to Rita, who's going to take us through some of the questions coming through the Q&A.
Hi everyone, I'm Rita. We've got a question so far from Quinn. He's asking, how many members does the Excellence Network have? Jane, would you like to take this one?
Okay, yeah, that's fine. Well, we don't ask the professionals to go through any formal registration period or membership application, but there are lots of ways they can get involved. For example, there are 7,000 subscribers to our monthly newsletter, and there are 1,500 subscribers to the regional mailing list now. So we've got a lot of people registered to have information sent to them. And I know, for example, that the Exercise Hub has 700 members on their list as well. So that there are a large number of people getting involved. They're just an indicator because they could just be getting the newsletter, but there are people who are very involved. So if anybody wants to get the newsletter, it's a really good way to find out what's going on.
Thank you, Jane. Just a reminder, if anyone has any more questions, please send them through the Q&A button at the bottom of your screen.
Okay, well, if there are no more questions, if anybody thinks of a question afterwards, please email into the email address that was in the session for any questions you might have. But thank you for attending today, and I hope you found it useful. And we look forward to hearing from you in the Excellence Network.